I'm Lisa Campbell from Start Training. So based on my post this week on Facebook, if you haven't checked it out, head to our website and check it out. What I'm talking about today is nondescript back pain in novice runners versus elite athletes. So today what I'm going to do is we're going to break it into two. So we're going to go novice runners first and then elite athletes, because there are distinct differences between the two as to where you would treat as opposed to the risk factors, causes, etc. So first things first, novice runners. So when we look at symptoms, we're looking at things like that general ache in the lower back, pain that can then go down the legs, issues across the tailbone sharp, pain with bending over, things where you're running and you stand on one leg for long periods of time. You get a lot of pain up through the SIJ joint and then in through the lower back, but also things like pain with extended periods of standing and sitting, or just generally you go for a really long run and then you wake up the next day and your back's really sore. So it can manifest in a lot of different ways, but what I want to talk about today is some of the risk factors and causes of that, but also then how we go about treating it and the differences between novice runners and elite athletes. So when we look at causes and risk factors, things like just general tightness. So one of the biggest differences that we'll find between novice athletes and elite athletes is it's a lot to do with movement mechanics and weakness and restriction. So biggest thing when you first have a novice runner come in, we've really got to look at decreasing that restriction. So stretching, getting your mobility right. You'll find a lot of the time lifestyle factors will influence this. So your average 35-year-old male spends sort of 5 days a week sitting at a desk, and then they decide to go for their 5-kilometer park run on the weekend. So hip flexors, lats, glutes, hamstrings, piriformis, which is one of your deep glute muscles. These are the kind of muscles that we need to be stretching ongoing in order to sort of decrease some of that restriction. Because what you'll find is when you're that restricted, your muscles are sort of working against, sort of like a handbrake. They're working against those other muscles, so it's really hard for you then to generate force efficiently. Movement mechanics are your next big thing. So the ability for the muscles to efficiently engage and work in the right way is massive. So not just getting the muscles engaged, but then the way that we use them in an efficient movement. So when we're propelling ourselves forward, so getting that really good upper hamstring glute engagement as you bring the leg through to move you forward. That's a massive thing that we'll find. So that neurological development and that recruitment. The next thing we look at is just general weakness. So weakness in the big muscles like glutes and hamstrings. You'll find that if they're not strong, then you're not going to propel yourself forwards. And in the combination of that, you'll find that the stabilizers are often not very strong either. So your auxiliary muscles, so essentially what you do is you're trying to develop force forwards and backwards. So your stabilizers are what keeps everything in line so that the force that you're generating is moving you efficiently forward as opposed to being lost laterally, making you really inefficient. So back to your lifestyle factors, so things like sitting all day at a desk, things where you're moving inefficiently around the workplace when you bend over, you're picking things up incorrectly. All of these factors make a massive difference then when you go out on the weekend and you decide you're going to do a 10-kilometer run, so your body doesn't know how to move effectively. Finally, what I want to talk about is warm up and cool down. So everyone always gets started and they're like, oh, I feel really stiff and sore, but then as you get going, you're like, oh, I feel great, muscles are moving, and then afterwards, you're like, oh, I'm gonna go and have my weekend coffee with my friends, so you don't cool down, you don't recover, and what happens is those muscles that were really warm and stretchy now basically condense down and tighten. So that then creates that pain the next day when you wake up or that afternoon even, and you're feeling really tight and restricted and you've got that ache. And those are those muscles that I was talking about before, so lats, glutes, hamstrings, piriformis, all really important that you stretch out after to sort of decrease that ongoing back pain post. So from an exercise intervention point of view, what we talk about really for novice runners is it's more about getting the muscles right than the volume of running. So a lot of people are like, I want to do a bridge to Brisbane, so they start Googling, all right, I'm going to how do I increase my running? But it's not necessarily the running that you need to increase. It's more about getting the muscles right in the right way so that you can run correctly, and that will help with that back pain. So range of motion. So what I was talking about before, that tightness. So getting the mobility and the range of the muscles so they can contract effectively. Muscle activation, specifically through your stabilizers, so that everything is generated efficiently. And then the biggest thing we then look at is muscle activation with neural development. So it's super important that you don't just engage the muscle, but you teach to work effectively. And that's when we talk about movement patterns and muscle mechanics and movement efficiency. It's, I now can get this working, but how does my body then use that? It's all about application. The next phase we look at is strength. So the ability to use those prime movers effectively, so those big muscles like hamstrings to extend the hip and the knee, and flex the knee, and then glutes, getting that good extension through the hip. Those big muscles are really important for generating force. And then finally, that's when we look at your running. And your running isn't about volume, okay? It's about getting the muscles working effectively, and then we slowly increase the volume. Let me assure you that if you Google the Kenya's National Running Program, you'll get into it. You've really got to make sure that the volume that you increase is moving really slowly. So we look at less than 10% in the first 4 to 6 weeks of increase in volume, and then you can slowly build on that. Alright guys, thanks for watching today. So I'm going to put out another video, so it's going to be part 2 of back pain related to novice versus elite. So that'll be more the elite side of things. So tune in, watch this space for that. Thanks.